You need to be fit and have good blood glucose control before any operation. But being in control doesn't end there. When it comes to a stay in hospital, we also want you to be in charge of your diabetes management. Alison's having an operation.
How are you doing today?
I'm fine, thank you.
Right, so you've been booked for a keyhole surgery on your left knee, isn't it?
Yes,
Okay.
yeah. I got type 2 diabetes, which I was diagnosed with about 4 years ago.
You had an HbA1c done a couple of weeks ago,
Yes,
which was 59.
Yes, because it was 80 when I...
Ah, wow, okay.
So I have brought it down.
How long ago was that?
3 months ago.
Pretty good.
Yes.
Yeah.
Ideally, your HbA1c should be less than 69 before an operation. Alison worked with her GP, who gave her tablets called metformin to help with her control.
And I have also lost a bit of weight, which has helped to bring down my result down to 59.
You need to do a blood sugar before you go to theatre, all right?
Yeah.
Is that okay? A little bit of blood. 10.1, okay?
Yeah.
Thank you very much.
As anaesthetists, we like our patients to be starved, but for diabetic patients, we don't want that starvation period to be for too long a period, so we like to keep it as short as we can. It's very important that they follow the advice given about their medications, especially their insulin, which if they take as normal whilst they're starved, then it can cause their blood sugars to become low and sometimes dangerously low. And there is also the chance that if their blood sugars are too high or too low around the time of their operation, then their operation will be cancelled.
As Alison knows only too well.
At the time when the operation was cancelled in April, I was disappointed, but I knew that I needed to get my blood glucose in control due to the high risks when you're having an operation of infection.
Patients who have an operation when their diabetes is not so well controlled have a few potential complications which could happen, but fairly commonly those patients' blood sugars are more difficult to control around the time of the operation. They're more likely to end up needing an insulin sliding scale, which in turn can cause a delayed discharge for them and mean that they have to stay in hospital for longer than anticipated.
Ideally, you'd only have an operation if your blood glucose levels are well controlled, but there are ways of delivering insulin and glucose through a drip to stabilise your levels, but it needs close medical supervision. The team at Neville Hall Hospital has been looking at the whole patient journey for people living with diabetes and trying to make it run as smoothly as possible.
It's about identifying diabetes as early as possible in the process so that when people know that they're expected to undergo an operation, they're given the right information to try and improve their diabetes control and start working on it from that moment.
While Alison is in theatre, diabetes nurse Chris Cottrell is working on her mission to remind people living with diabetes about the importance of flagging it up.
Bore da.
Hello.
How are you?
Okay, not too bad.
Okay.
Yeah.
What about your insulin passport? Did you remember to bring that in with you? No. And why is that so important, Matthew?
I know.
If you control your diabetes with insulin, this will help nursing staff to help you.
Just so happens, like Blue Peter, I brought one in ready.
Brilliant.
But you need to fill this in now.
All right, okay.
So your name and address is there.
Yeah.
You need to put in your telephone number, who your GP is, just in
Okay.
case you need to contact them, and then who your emergency contact is. Then there's a place there to write down your most up-to-date medications. But on the back, and this is crucial now, it's just telling whoever sees you that you are on this type of insulin and what the pen device that you're using is. And we do encourage people to either carry them in their wallets or in their purses. The whole idea is that they've got some sort of identification on them when they come in for those times that they may be collapsed. A lot of people, they do wear the medic alert. Have you heard of these, Matthew?
I think yes.
Yes, you've got one. That is the medic alert.
Yes.
So when people with any sort of condition, but with diabetes, if they wear one of these, that'll alert staff then to the fact that they've got a condition. So that is brilliant, but they do come in all sort of fancy designs now, and leather ones for men as well, but that's a nice manly one,
Yes,
so that's good.
Yeah. Totally forgot, to be quite honest. Yes.
But that's not bad, because the thing is, you forgot who said, so it shows that
Yeah.
you're wearing it all the time,
Yes,
isn't it?
yeah.
Yeah, so that's good. Okay,
I don't take it off, to be quite honest.
yeah, good. And that is the beauty of these things in an emergency.
Think about putting a grab bag together. It could be by the front door, clearly labelled with information in it about how you manage your diabetes, as well as a spare toothbrush. It's about doing everything you can to help hospital staff help you. Alison is back on the ward. It's been a textbook operation. Her blood glucose is under good control.
I'm feeling tired now after the operation and just coming around now. But yeah, looking forward to some sandwiches and then going home.
Patients can make their time in hospital easier if they stick to the regime that they're on currently. Obviously they'll have a pre-planned care plan, which they are to bring in. We also have a copy, so we know what we should be doing with their diabetes prior to coming in. And if they can follow that, it should be fine, and it should run smoothly then during the course of their stay and hopefully till their discharge then.
Yeah, lovely. All done.
Thank you.
Okay.
Whether your diabetes is type 1 or type 2, if you've been in hospital for an operation, it is really important to be on top of any new medication.
It is really important that you make sure that you, as the person going home, understand what you're taking home, why you're taking it home, and what you're supposed to be taking and when. Right, yes, you both. Ta-da.
Coming to hospital for an operation can be stressful enough, even if it is planned, but you won't go far wrong so long as you remember to talk to your diabetes team before you go into hospital if you're unsure what to do with your medication, even if it's a day case. Take your medication on time and check any instructions to stop taking it. Watch any wounds for signs of infection. Test regularly. Blood glucose can behave differently in hospital. Ask the nursing team if you want to take back control of your meds, but do tell them about any high or low readings. And also tell them if you're not comfortable with any decisions about your diabetes management. And when you get home, just in case of an emergency, think about wearing an identity bracelet and carry your insulin passport.
And it is well worth it in the end.